Hello, class. This is Philip Mathis, and I am assisting Joy and CJ in our presentation of Improving Access to Emergency Psychiatric Care Act.
Hi guys, I'm CJ. The Improving Access to Emergency Psychiatric Care Act addresses gaps in emergency psychiatric care for underserved populations, including Medicaid recipients and rural communities. The objectives of the Act are to enhance access through increased Medicaid and Medicare coverage, and to improve provider coordination among hospitals, psychiatric hospitals, and community mental health services. And the target outcome is to ensure timely and equitable psychiatric crisis care for those in need.
The Access to Psychiatric Care Act is a legislative initiative aimed at addressing the ongoing shortage of mental health providers and improving access to psychiatric services across the United States. It was introduced as a response to the critical demand for mental health care professionals, especially in underserved and rural areas where shortages are most pronounced. The Act primarily focuses on expanding the workforce of psychiatric providers and reducing regulatory barriers that limit access to mental health services for individuals with mental illness.
So, a little bit of history on this act. Um, the Social Security Amendments of 1965 created Medicaid and Medicare, but limited federal support for mental institutions to patients age 65 and above. Medicaid IMD exclusions of 1972 and 1988 reduced coverage for inpatient mental health services for those aged 21 to 64. The Emergency Medical Treatment and Labor Act of 1986 mandated hospitals to treat all patients until they were stable, addressing patient dumping practices. And a Medicaid demonstration program under the Affordable Care Act of 2010 allowed some hospitals to receive Medicaid reimbursement for emergency psychiatric care for working age adults. This program highlighted the challenges in accessing inpatient psychiatric facilities, leading to the creation of the Improving Access to Emergency Psychiatric Care Act, which aimed to improve this access. So some of the reasons that we need this type of policy, according to NAMI and the National Institute of Mental Health, in 2021, 57.8 million adults in the U.S. had a mental illness, but only 47.2% of those received treatment. Some barriers to those receiving care. The major obstacles include insurance limitations, high out-of-pocket costs, geographic inaccessibility, a shortage of in-network providers, and low Medicaid reimbursement rates. So the rural and underserved communities face higher rates of untreated mental illness, exacerbating social inequities and increasing emergency room visits.
Policy goal and objectives. The policy's goal is to expand emergency psychiatric services to Medicaid beneficiaries and enhance coordination between healthcare facilities, while its objective is to increase Medicaid reimbursement rates for emergency psychiatric services and encourage partnership between psychiatric facilities, hospitals, and community-based services to ensure comprehensive care. Analysis of the policy. The Act is legal and just as it aligns with federal healthcare laws and aims to improve access to healthcare for all qualified individuals, particularly addressing health disparities within the underserved population. Mental health advocates healthcare providers, and community organizations are in support of the policy. However, potential opposition may arise from budget constraints. Overall, the public perception about the policy is positive, and people who understand the necessity of developing mental health services support it. So, policy alternatives. The Improving Access to Emergency Psychiatric Care Act addresses the significant gaps in emergency mental health services by expanding access through Medicaid, improving insurance coverage for psychiatric emergencies, and ensuring sustainable community centered funding models to overcome geographic and social economic barriers in psychiatric care. So, points. Status quo. The IMD, Institution for Mental Diseases exclusion, continues to exclude Medicaid reimbursement for psychiatric facilities, which is cutting off psychiatric emergency care. Insurance-based model. So these models have mandated private insurers to cover emergency psychiatric services. While this may increase access for some, it may not do enough to address the need of rural and low income areas. Community centric funding model. So, grant money from the federal level to put up psychiatric facilities in areas where the population lacks better medical facilities. This is directly addressing geographic disparities, but this may be lacking long-term funding. So the chosen alternative would be to clarify schemes that enhance Medicaid coverage with coordinated provider networks for expanding access and for stable backup of emergency psychiatric care. Policy implementation. So the short-term action is to increase Medicaid reimbursement to psychiatric facilities, while long-term action is to minimize the use of emergency services when dealing with psychiatric issues and enhance the capacity of specialized psychiatric treatments. So funding for the policy is primarily generated from Medicaid collections at federal and state levels, specifically from the Center for Medicare and Medicaid Services.
To enhance the success and applicability of the Act, several targeted recommendations could strengthen its impact. First, expanding funding for training programs and loan forgiveness for psychiatric providers, especially those committed to work in underserved areas, could address the workforce shortage by attracting more professionals into the field. Additionally, broadening scope of practice regulations for psychiatric nurse practitioners and clinical social workers would allow these professionals to offer more services independently, making care more accessible in rural and underserved regions. Integrating telepsychiatry within primary care settings could also improve access, enabling clients to receive psychiatric consultations in a familiar setting with a streamlined referral process. Furthermore, requiring insurance reimbursement parity for telepsychiatric services would help prevent high out-of-pocket costs, which are often a barrier to seeking care. Finally, partnership with community organizations and investment in preventative mental health services could ensure that psychiatric care reaches diverse populations and reduce long-term demand for addressing issues earlier. Together, these measures would make the Act more effective and sustainable, providing broader and more equitable access to mental health services. This Act promises significant benefits for individuals experiencing mental health crises and for the healthcare and public safety systems that support them. By expanding access to timely and specialized psychiatric emergency care, this act can help reduce the overuse of emergency rooms and decrease the reliance on law enforcement to handle psychiatric crises. Individuals in crisis would be able to receive the appropriate care faster, potentially preventing escalation of symptoms and leading to quicker stabilization and recovery. This timely intervention not only reduces personal suffering, but also promotes better outcomes by addressing mental health emergencies before they lead to longer term hospitalizations or incarcerations. Additionally, the act could relieve the burden of overcrowded emergency rooms, freeing up resources for other critical care needs. Ultimately, this act fosters a more responsive, compassionate, and efficient mental health crisis response system, benefiting individuals, families, communities, and healthcare providers alike. The Access to Psychiatric Care Act is highly relevant to social workers and their clients as it seeks to alleviate barriers to mental health services that both groups frequently encounter. For social workers, especially those in clinical and community settings, the Act's emphasis on expanding access to psychiatric care means that they could have more resources and partnerships to refer clients for specialized psychiatric services. The Act's support for telepsychiatry, for example, would allow social workers to connect clients with psychiatric providers regardless of geographic barrier, a significant benefit for those in rural and underserved areas. For clients, especially those facing chronic mental health conditions, this legislation promises shorter wait times, increased availability of psychiatric providers, and potentially lower costs for psychiatric services. This improved access can be life-changing as untreated mental health conditions often impact overall well-being, social stability, and quality of life. Ultimately, the Act empowers social workers to better support their clients by facilitating access to the comprehensive mental health care they need, promoting improved mental health outcomes in the community they serve.
In conclusion, the Improving Access to Emergency Psychiatric Care Act has made a good start in expanding access to emergency psychiatric care, but further efforts are needed for a comprehensive impact. So some future recommendations would be emphasis should be placed on sustained funding, first responder training, and prevention services to address long-term mental health disparities. And a final call to action: building a resilient mental health system requires ongoing policy support and active engagement from clergy and advocates for equitable psychiatric care. And that completes our presentation. Please see the next slide for our references, and thanks for watching.